Thank you, colleagues, for joining us for our Member Showcase presentation. This is the part of the programme each day where we highlight some of the great work being done within the sector. Today's showcase features Great Ormond Street Hospital for sick children. We find out how the Trust's new virtual wellbeing hub helps identify staff health and well-being, as well as providing access to external mental health services throughout the pandemic. We'll get an opportunity to view a short animated video followed by a presentation by Dr. Daljit Hothi, Associate Medical Director for Wellbeing, Leadership and Improvement at Great Ormond Street. There'll be a short Q&A after the presentation. If you'd like to ask a question, use the raise hand function or put it into the Q&A box. So with that, I'll pass on to Daljit.
At the start of the pandemic, Great Ormond Street Hospital for Children NHS Foundation Trust identified the importance of developing a mental health and emotional wellbeing support structure for staff. A wellbeing operational group was formed and adopted a collaborative, distributed and intent-based leadership approach, leading a multidisciplinary team of experts to create a new virtual wellbeing hub with links to Camden Mental Health Trust. The hub identifies staff health and wellbeing needs, redirecting staff to psychological first aid and, when required, facilitates referral of staff members for external mental health services. The wellbeing service has extended beyond the hub, creating a multi-layered, multi-dimensional offering peer support workers, TRIM practitioners, and wellbeing coaches. The hub is agile and continues to connect with and adapt to the unique needs of colleagues. The team also initiated a growing internal and external-facing wellbeing network to meet the demands of COVID-19 and other smaller, repeated traumas that healthcare workers continue to face. The hub and other responses allowed Great Ormond Street Hospital to raise the profile and importance of staff welfare, with 17% more staff feeling that the Trust had taken positive action towards their health and wellbeing.
So thank you for the opportunity to speak about the GOSH Wellbeing Service, a service I co-led with my colleague Mandy Bryan, who's a consultant psychologist. So in March 2020, the world changed. Apologies. A pandemic was rapidly spreading and people were dying. In the UK, the country went into lockdown, and the NHS was at risk of being overwhelmed. We had limited bed capacity, especially critical care beds, limited knowledge on how best to treat patients with COVID. And one of the greatest challenges, a finite number of staff to look after our patients. Those that were working, especially those in the front line, were tired, frightened for their own health, and emotionally and mentally worn out owing to the exceptional circumstances within which they were working. Experts were advising the government and healthcare providers about the significant and real risk of moral distress and moral trauma. We at GOSH, like many NHS trusts, responded by making staff mental health and wellbeing a priority. Our story begins with this, the Cynefin framework. It's a decision framework which I personally find extremely helpful to categorise the system within which we are working, and from that determine what leadership approach will be most effective. At the beginning, in March 2020, I felt that we were entering a complicated system, where there's a relationship between cause and effect, but this is not evident to everyone. You need experts to help you analyse the data or the evidence, experts to explore the different options and use their judgment to make a good decision, to offer a good solution. The complicated system is effectively a space of good practice because there are multiple answers or solutions. All are legitimate, providing you have the desired expertise. So I immediately recruited expertise, Mandy Bryan, the lead for psychology and mental health services within the Trust. And this was the first deviation from my standard approach. Ordinarily, health and wellbeing is led and directed by HR and occupational health. Now, international experts in trauma and psychology were advocating for a layered, hierarchical, interventional approach to mental and emotional wellbeing. So you start with primary initiatives, through changes in the way work is organised, to manage and minimise the mental emotional load, maximising staff basic physiological needs and safety needs, followed by secondary initiatives to promote wellbeing, manage stress, mindfulness and resilience. And thirdly, the tertiary initiatives, addressing wellbeing issues as they arise with early intervention and treatment. At GOSH, we elected to invert the pyramid. Firstly, we mobilised the specialists or experts, and within 2 weeks, we had created a virtual wellbeing hub run by these trained psychologists and experts in mental health. We secured support from Camden Adult Mental Health Trust, ensuring that we had seamless access to adult psychiatrists for advice and to refer staff members for treatment. Camden adjusted their referral criteria, accepting NHS staff that worked in their catchment area, in addition to those that lived in their catchment area. We provided bereavement support. Next, we created posters, screensavers, and an intranet site signposting staff to resources outside the trust, mindful that some staff would prefer to speak to experts that do not work within the trust. In parallel, the trust set about shielding staff members, relocating staff home and providing them with IT equipment to be able to work from home. Clinical staff were offered hotel accommodation to avoid long commutes. Meals were provided during work shifts, and international medical graduates were offered accommodation and food. Prior to COVID, wellbeing support was procured to Care First, and this service continued throughout COVID. As COVID hit London, GOSH started preparing for gold, silver and bronze meetings. However, the tsunami did not quite hit GOSH, but the anticipation, the threat was always there. Life had changed and services were being disrupted. We have a larger proportion of international medical graduates than most other organisations, and they needed our support. North London paediatric services were being redirected to GOSH. Staff were being redeployed to adult services. And data was starting to emerge that perhaps BAME staff were more vulnerable than others. And then reality really hit. One of our most senior staff nurses was infected by COVID, and after weeks of treatment, she sadly died. This hit the organisation hard. From a wellbeing perspective, we had similarities to other trusts, but also many differences as a standalone paediatric unit. Our experiences were unique. We had, in fact, moved to a complex system, an unordered, unpredictable system, a space of unknown unknowns. In this system, right answers do not exist. It's a space of emergent practice. Elements of the system are linked through intricate interdependencies. As a leader, we must not attempt to impose a course of action. We need to probe, sense, and respond. We need to establish safe-to-fail experiments that you can amplify or dampen, not fail-safe solutions. So Mandy and I embraced this iterative approach. We set out designing multiple concurrent experiments through which emerged a multi-layered, multi-dimensional wellbeing offer. We established a multidisciplinary wellbeing operational group with expertise in mental health, HR, coaching, and clinical staff. We procured training in evidence-based practices such as REACT mental health training and training trauma risk management practitioners, or TRIM as we fondly call them. But we soon learned that these solutions need to be adapted and refined for our organisation to make them a better fit. We developed homegrown solutions, wellbeing messages, a Wellbeing Wednesday webinar series, a wellbeing indicator. We created generic interventions, but also targeted interventions for hidden and hard to reach communities. And then finally, as we started to move out of the acute phase, we recognised the need to shift our focus from the detection and management of the manifestations of COVID to a broader awareness of the impact of everyday traumas that healthcare workers experience. A focus not only on shifting colleagues from a negative state to a neutral state, the space of coping and surviving, but actually promoting a journey from neutral to a positive state of wellness and thriving. The infrastructure we continue to develop is directed to individuals and teams. We have trained peer support workers to connect with colleagues, listen, signpost, and provide basic psychological first aid. We have wellbeing coaches that provide a series of coaching sessions to manage anxiety, stress, or help staff to reframe and mentally adjust to their new lives. And finally, TRIM practitioners that assess colleagues for trauma, a step in changing the culture where trauma is discussed openly and then managed. For teams, the approach follows a similar principle, but starts with the team diagnostics. We support teams to create locally grown initiatives for team self-care, team interventions such as team coaching sessions to promote team resilience and growth, and then specialised team interventions following significant events. And this is an example of our homegrown solution that really landed with staff and was utilised at staff handover, the start of staff meetings, everywhere, just to check in.
How are you today? It seems an obvious question to ask, right? Yet simple conversation is often overlooked at times of stress. Yet connecting through conversation is crucial for mental health and well-being. Introducing GOSH, an acronym to prompt wellbeing conversation. Firstly, good. Be sure to say good morning or good evening and thank you for coming to work. A simple open greeting and acknowledgement can set your tone for the day. Second, okay. Ask how are you doing to check in and see how others are feeling. Third, share. Create a safe space to share exchanges or experiences. Finally, help is always at hand. Signpost to internal and external resources on the Wellbeing Hub when you can't get an answer straight away. So, go ahead, turn round yours or your colleague's day by prompting wellbeing conversation using GOSH. Head to the Wellbeing Hub on the GOSH intranet to learn more.
And the impact. One of my earliest memories and largest memories of COVID was a shift in the public's attitude towards the NHS. And time will tell if this is truly a gift. Medicine, science was seen as an ally. Our expertise is honoured, acknowledged and accepted, not something to be treated with scepticism or caution. Within healthcare organisations, priorities changed. The wellbeing of NHS staff became important. The NHS was cared for as much as we cared for our communities. And within GOSH, we saw evidence of the wellbeing service being used. Care First received 72 calls for emotional health last year. The GOSH Wellbeing Hub responded to more than 1,000 requests for support. GOSH staff members were asked to complete the staff survey in autumn, 6 months after the GOSH Wellbeing Service was started. We saw a 17% increase in staff responding to the question, does your organisation take positive action on health and wellbeing? This was the largest positive change of all the questions asked, but as you can see, we still have a long way to go. I'm also keen to hear from my colleagues here today about their experience, and I have a poll question. In your opinion, what wellbeing services have staff within NHS organisations found the most helpful? I'd be grateful if you could answer that question on the poll. One more minute. Okay, so if we can have the results, please. Wonderful, thank you. Similar to our experiences, I appreciate that. I thought I would end the talk today with some reflections of what I have learned personally. Our success at GOSH lay in a distributed expert-led service, recruiting colleagues across the hospital, as opposed to setting this task onto one team, the HR and occupational health team. We found that context was so important. In order to share their vulnerabilities, staff needed to feel psychologically safe, felt heard and included. And they got this from their GOSH colleagues. With staff reporting, they know what it's like at GOSH. They know what it's like to work here. We realised that listening skills were more important than expertise on mental health. Wellbeing strategies needed to address organisational structures and processes, as well as interventions to promote our staff emotional, mental and cognitive wellbeing. And finally, within our multiple attempts to engage staff, terminology was so important. Wellbeing was received far better than the word resilience. We found that we needed to use the hook of cognitive resilience as well as the mental resilience. The touchy-feely stuff was not for everyone. And finally, normalisation. We need to normalise the pandemic trauma, but also the everyday traumas of healthcare. And I'd like to end the session conscious that, as I said, the trust is a long way to go and challenges in the NHS are far from over. So I'm keen to consult from you today with this second poll question. In your opinion, what is our priority in supporting NHS staff in the next 2 to 3 years? I'll give you another 30 seconds and then we'll get the answers. If I could have the results now, please. Thank you. A mixed bag. So mental health surveillance and treatment, burnout surveillance and treatment, and then redesigning NHS policies, infrastructures that prevent and promote staff wellness. Thank you for your time, and I'm here for any questions that you may have for me. Thank you.
Thanks, Daljit. That's really inspiring, I think, and a fantastic initiative. And it's incredibly comprehensive, and also it's clearly quite a bespoke program for a very specific trust, isn't it? How much of that do you think is directly transferable to other organisations?
I think in truth, the principles and the approach that we use are certainly transferable, but I would certainly encourage people to adapt and refine all of these approaches specifically for their organisation, because that will really improve the engagement. So if it feels like it's homegrown, that it's catered and individualised for your own organisation, I really feel that's what will take you from good to better. Yeah,
that was what was coming out of the answers to that last poll, wasn't it? Do you feel it's now embedded in GOSH? Is this? I mean, you've been talking at the end there about looking forward into a post-COVID world. Do you think it's now an embedded part of the GOSH offer, if you like, to start?
Yeah, absolutely. I mean, we now have the virtual big briefs, which the CEO hosts every week, and there's always a wellbeing question. I attend lots of meetings. I spend my day on Zooms, and it's interesting. People will talk about wellbeing. How is everyone today? Conscious of the timing of meetings. Are we really paying attention to people's wellbeing? We are sometimes responsible for the burnout and the stress that we're imposing on our colleagues. So actually, we need to take responsibility for that. But then as individuals, we need to self-care for ourselves as well. So I think that's a really important message. But I hear it everywhere now. It's really refreshing to see people talking about well-being. What about my well-being? What can I do differently? We have people going for walks at lunchtime. When people are arranging meetings, they'll go for a walk rather than sitting in an office. I mean, it's great. I certainly see a shift. I just hope it will continue. As I see the stress levels rising, as people are coming out of this second phase, I see tiredness and a lot of anxiety. And I think people need time to recover, time to take stock of what's happened. But hopefully this thread of well-being and thriving will carry us through in the recovery phase.
Yeah. I mean, clearly this is, as I was saying a moment ago, a very comprehensive program covering all sorts of manifestations of support. But what would you say was the core? What was the bit you would most want to hold on to, regardless of whether some of the other stuff was lost in the next few months?
I think we created a community. We didn't just engage experts, we engaged as much of the organisation as possible in our work. And so actually everyone became an expert, everyone wanted to talk about wellbeing, everyone encouraged wellbeing of themselves and their peers. So I think it's almost the creating a community of this. It's almost spreading the energy of wellbeing from one individual to the next. So the community just built itself and it grew and grew and grew. And I think that was our biggest success. Rather than saying there's a handful of experts, we encourage the expertise to spread far and wide. And I think that was the greatest success.
Fantastic. I really enjoyed that. And I think colleagues did as well. It's really exciting initiative, and it really is where the NHS should be going. We should be an exemplar really for everyone else in this space, shouldn't we? But seems to have taken the COVID experience to really push us to this level, doesn't it? But really,
it's a great gift to be left with, isn't it, from COVID, is to start talking about staff wellbeing. Absolutely.
Thank you for sharing it. That's been really exciting, and I'm sure colleagues have enjoyed it, and more power to your elbow going forward.
Thank you so much. Thank you for the opportunity.